start the presentation. I don't know how much you are earning. I don't know how close you are to retirement. I don't know who are the people that are surrounding you and how you are taking care of them. But one thing is sure, income can be zero, but expenses can never be zero. And one of the major expense that a man will incur in life is the medical expenses, especially in the healthcare sector. And that is one expense you don't want to incur or you don't want to face at at the later part of life. Unfortunately, it does happen. You see quite a number of persons, they retire today and then maybe 2, 3 months they fall sick. And because once they fall sick like that, the next thing, everything that they ever call gratuity or pension, everything is going into that health care. And that is, it's not supposed to be so. Also, you have a man, a woman that is working very hard, and as much as he makes, there's a particular child in the family, or there are sometimes in the family that you have to kind of visit the hospital every now and then. You have to spend a lot of money in the hospital. Ladies and gentlemen, I want to tell you this ought not to be so. And if we say it ought not to be so, what should be? What should be? It is important that we should take advantage of the system that is built around us. But because of ignorance, a lot of persons are ignorant of it. Somebody is ill now, has to go to the hospital. They are looking at many times. I belong to quite a number of groups, and you will hear something like, please, let's gather together, let's contribute money because so and so person is in the hospital, they can't pay their hospital bill. Nobody plans to be in the hospital. You don't wake up in the morning and say, I plan to get admitted. Nobody. It comes just like that. But then when it comes, how are you taken care of? How are you taken care of? How are the people that are around you taken care of? Oh, you have an aged mother, a father, a mother. Way back in the village, you might be located in the United States or any part of the world. You have your aged parents anywhere. You have your aunts, your parents, people that will always call you when there are challenges. They will call you and say, please come to our aid. So and so person is sick and things. And you begin, that could be one of your downtime when you don't even have enough money on you, but they expect you to perform something. Now, when you put all these things together, you want to think, what can I do? For those of us those persons that are outside the country, you will know that they don't play with insurance and all this stuff. And somebody will say, oh, that is abroad. We don't have it in Nigeria here. Who told you that? It is accessible based on the information that you have. I recently met a young man whose wife, his wife had to go to, his wife was pregnant. And when the pregnancy was about 3 months or thereabout, someone just rightly advised her or him that you better go and register your wife for so and so thing and so on. So they went ahead, did the registration. And upon the registration, do you know that on the day of delivery, they were not preparing for CS session. They were not preparing for CS session. This is a man that lost his job. He didn't lose his job before he got his wife pregnant anyway. It was in the course before the term date. Before the term date, that was when he lost his job. And the moment he lost his job, sorry, the power is okay. All right. So the moment he lost his job, what happened? Music. So the moment he lost his job, he didn't have enough money. He didn't have money again. Not that he didn't even have enough money. Uh, just just a minute. This light is casting shadows. Okay. So sorry for the poor lightning. uh, there's a heavy storm out there, and the power stuff just went off. And okay, all right, don't let me be distracted. So, what happened to this young man? On the time of delivery, he took his wife to the hospital and they said they were going to go through operation. And the thing is, the guy went berserk. He was confused on what to do. But then somebody said, didn't you register? The person that advised him to register for the insurance scheme said, but you register for the insurance scheme. Why don't you just go and apply for it? And he gave them his number. When he gave them his number and everything, would you know what? They did the CS operation. After the CS operation, they did everything, took care of the child, took care of everything. And the man was waiting that, let me see what the bill is going to be after the whole stuff. And you know what? When the bill came, they gave me a bill of about 2,500. He took the 2,000, he took the papers, went to the store, paid the 2,500. He said maybe this one is just dropped. He was waiting for the real bill. But the real bill never came. He went, he was waiting for them to call him back and say, you can't go. Nobody called him back. He went and he was so excited. Now, this man, not long after that, he fell sick himself. He went to one of the hospitals. He got treated. The 2,500 naira he paid was the 10% value of the total drugs that was administered to him. Now, this man never knew something like this happened. I was in the midst of some colleagues, some friends recently, and I was telling them about the benefits of these things and what they stand to benefit on this. And, a lot of learned persons, they never know that something like this is existing. Now, let's quickly go. I just have a short presentation just to show us the some of the benefits of this greater scheme. I want you to make sure you have a clear understanding, subscribe, and also share this video with your friends so that they also can partake in this great offer. I tell you, will be, will I say, you'll be tantamount. It will be tantamount to wickedness if you have the understanding of this and you don't share it with people. All right. So let's go. I think I'm sure the screen is visible. Please, if you have to comment, make sure you click on subscribe. If you don't subscribe, you might not be able to make a comment on the chat. So just click on the subscription button. When you click on the subscription button, you'll be able to make comments on the presentation as we go along. Now, if you look at the average cost of healthcare services and insurance in Nigeria and in most parts of Africa. Now, let's look at healthcare services. If somebody wants to go treat malaria now, he enters into a hospital, he will be asked to pay for consultation. He will pay consultation fee, which ranges between 3,000 to 10,000. There are some that are even 50,000, depending on the kind of hospital that you are in. It depends on the hospital that will determine. So you want to look at that is a cost on its own. Now, the other cost, the cost of medication and treatment can vary significantly depending on the type and duration of the care needed. Now, I begin to look at something, guys. Please pay attention here. If you are working in a corporate organization. Oh, it is good. They can pay this thing for you. But I tell you, healthcare services is not what you want to use your retirement benefits for. Healthcare services is not what you want to start spending on in this kind of economy. This economy that everything is so tight. How much per liter of oil, per liter of gas, and everything. So are you going to add these healthcare expenses to it? I think wisdom demands that whatsoever I can do to reduce my healthcare expense, I should. There are a lot of outlets that are taking away your money. Should healthcare be one of them? If there are options, if there are alternatives to have good plans. So, what do you need to do to reduce or to manage your expenses as far as healthcare is concerned? So, the number one thing is you must consider enrolling in a health insurance scheme to reduce out of pocket expenses. Health insurance scheme, I tell you, it's been for a while. I'm going to give you don't worry, I'm going to show you the full thing here, how you can benefit. Now, the other thing is, what do you do to reduce your health care expenses? One, and the second thing is, take preventive measures to maintain good health and minimize need for extensive medical care. Now, this is where we talk about preventives. How are you taking care of yourself? Are you doing the regular exercises? Are you watching your meals? What are the things that you are taking into your body? You must be, was it Aristotle or one of these philosophers? He said, let thy food be thy medicine, and thy medicine thy food. Did you get that? Let thy food be thy medicine, and thy medicine thy food. That means when you are eating, eat as if you are taking care of something in your body. That means I'm conscious of vitamins, minerals, and everything, and so on like that in any food. I don't just eat because I am hungry. I take a bar, mala, then put in, just eat things that will just make you get what I'm saying? Now, consult with healthcare professionals to explore affordable alternatives and generic medication options. These are things that we encourage our cooperators, members of our cooperative. You should at every time look at what are the alternative healthcare services that are open to you. So stay physically active and maintain a healthy lifestyle to reduce the risk of chronic illnesses. Ladies and gentlemen, you don't want to add a chronic illness, whether by relatives or to yourself, to the present economic conditions that we have in Nigeria. I'm telling you, you don't want to do that. Imagine you are thinking on, how am I going to pay the children's school fees? How am I going to get to the office? And then somebody comes up and tells you, Mama is sick in the village. And then you begin to run helter-skelter because you don't want Mama to die. That's another cost. So you begin to run helter-skelter. Now, do you know you can prevent that? I have people on our scheme that, they are aged mother. They are not with them here. Maybe the children are abroad. You are abroad. You are maybe anywhere outside the country. You are not where your parents are. Then you are not giving them any health insurance scheme. You're going to spend out of your nostrils to make sure they are healthy when it happens. So what do you need to do? Now, this is where the NHIA comes in. Now, hold on. I know you will say, okay, is this thing that is talking about the NHIS? This is not NHIS. This is NHIA, the National Health Insurance Authority. By the way, you must know that NHIS has been scrapped. The NHIS scheme has been scrapped because it was not addressing enough the health challenges that people were facing, because it took care of just some primary health issues. So we're going to look at what is it that this NHIA is going to take care. Now, mind you, anyone can go access this, but we've brought this specially on the platform of the Rich Vision Cooperative, that our cooperative members will be able to have an understanding of how to keep themselves. In the cooperative, we stand by 3 M's: manage money, make money, multiply money, and manage money. Make money, multiply money, and manage money. If you are not making money, if you are making money, you must be multiplying it. If you are not making money, you should be managing your finances. It is very, very critical. Now, what are the benefits of this scheme or program, so to speak, the gift ship? Now, benefits and packages are healthcare services defined by NHIA as within its scope of coverage. Their services enrollee enjoy as contributors to the authority. Now, you must understand something. For members of the Rich Vision Cooperative, we are not charging anything extra. For you to be once you're a member of the Rich Vision Cooperative, we will help you even in the processing of this. Now, for many persons that are working, well, maybe you are working in a federal government establishment, in a corporate organization where they have taken care of your health insurance. But the question is, how about people around you? How about your children that are above the age of 18? Once they're above the age of 18, the scheme might not cover them. Your parents that are above the age of 60 and so on. But with the NHIS program, even when they are above 60 years, it takes care of them. Just hold on and just go with me. So what are the specialty services under the NHIA? We have what we call the primary health care. We have general surgery. Somebody he got his hand broken or he had an accident, something. The program, this scheme is going to take care of that person without that person paying a further. Internal medicine, O&G, pharmacy. You go to when you are under NHI, you go to the pharmacy, the doctor prescribes for you, and they write drug of maybe about 50,000 naira and so on. You don't need to pay that kind of money. They are just going to charge you like 10% of the 50,000 naira, which is just about 5,000 naira. Can you imagine that? Laboratory, you want to go for some tests, they told you go and do CG, urinary test, pregnancy test, global test, and this system we pay. Pediatric, radiology, dental services. You want to, you have tooth issue, you want to pluck off your teeth, whatsoever, the system is going to take care. I don't think some of these things, the NHIS program was not taking care of it. So we have, can you imagine psychiatric services is covered, orthopedic services, surgery is covered, physiotherapy is covered, ENT, you have issues with your ear, with your nose, eyes, and so on. It is covered. Optometry, they recommend, you can go do some eye test. The former program just covers maybe your the eye test. I finished doing an eye test. Then how do I get the glasses? This program covers, you can get brand new glasses. That's for those of you that uses that. So don't be afraid to go, and if you want to go do glasses on your own, you might be paying 40, 50, 60, depending on this. But this system covers it. The only thing it will not cover is that if you are going to pick a designer frame. Now, understand. Now, ophthalmology, electrocardiography, can you imagine it covers endoscopy, urology, dermatology, when your skin is having issues, you don't know what is going on. Go to use this scheme, you will be treated for free. Neurology, cardiology, nephrology, all the GGGGG. Oh my God. So, ladies and gentlemen, now let's think about it. Let's talk about this. What are the schemes? What do we consider as the different levels of care? Now, there are 3 levels of health care as far as NHIA is concerned. We have the primary care level, we have the secondary care level, and we have the tertiary care level. Now, when we talk about the primary care level, we talk of government PHC, non-specialist hospital, you go to general hospitals and things. So when you talk of primary, this is the entry point and the point of first contact of enrollees with the HCF. Now, there are various hospitals around you, health centers around you. Once you enter inside there and you see NHIA is accepted there, just go register there. Do you understand? So whether you have malaria, somebody I had an experience, somebody had this malaria fever and he had to go to the hospital. Now, getting to the hospital, he had to pay consultants. He first of all paid registration fee. Registration fee was 5,000 naira. Then consultation was 10,000. At the end, they gave him malaria, this and things. By the time they finished everything, he was paying close to 20,000 naira for just treatment of malaria, for crying out loud. Meanwhile, If this person was under the NHIA, he will have just strolled in. He will not pay any consultation fee. He will not pay any registration fee. He just goes there. He gets treated. The service is getting better and better and better every day. So we have the primary care where they take care of the normal, fever, measles, the general stuffs around there. Then we have the secondary care level. Now, whatsoever cannot be handled in the primary care is transferred to the secondary care. Now, do I have to go and register again for the secondary care? No. A note is given to you by the primary care provider, making a recommendation for you and transferring you maybe to the general hospital or to a specialist or private hospital. This level offers specialized services to enrollees referred from the primary health management care. Now, we have the tertiary. Now, we have the tertiary. What are the tertiary health care level? That's where we talk of the teaching hospitals and specialized hospitals. Do you need to go register again? No, you don't need to register. It's just a recommendation note from your secondary care to your tertiary care. Now, you ask, how much does this thing cost? Do we just, are we going to pay through our noses and everything to do that? Now, ladies and gentlemen, do you know the interesting thing about this? Insurance, the concept of insurance is that we pay for something that we don't know whether it will happen or not. But we pay a fraction. Take, for instance, you bought a car. The car is 20 million naira. 20 million naira. Can 20 million naira buy a new car now? Maybe a Chocobo car. Anyway, now 20 million naira. Now you decide to do a comprehensive insurance on that car. Now you pay, I think it's about 5% or thereabout. 5% of 20 million naira, maybe that's about 1 million naira for the comprehensive insurance. You went to the insurance company today or yesterday, and then the next day you went to a party and you parked the car somewhere. And suddenly you came out after the party, the car has disfarahan, it has disappeared or more. What are you going to do? All you just need to do is get evidence that that thing really happened in that place, and you call your insurance. What will your insurance do? They will simply come, look at it, give the assessment, and as early as possible, as quickly as possible, they are going to buy you a new car. The same car or whichever one within the range of what you insured your car for. Now, somebody will ask, but I just paid 1 million naira to the insurance company. How are they able to buy me a car of 20 million? Now, remember, some other persons had paid the money, but they never had cause to use it. So, the funds put together in that insurance pool is what is used to indemnify those other persons that have issues with it. I think you get it. Now, how much will this thing care cost? Oh, I know somebody treating prostrate. Can this thing cover prostrate treatment? Can it cover cancer treatment? Can it cover operation on fibroid? Can it cover, people ask different questions. Now, let me tell you this. How much do you need to start this? It's just 15,000 naira. 15,000 naira annual payment. So when you pay 15,000 naira in a year, it covers you for 12 months. Thank God if you never have cost to go use it. Oh, glory be to God. But if there's need for you to use it for any reason, the whole expense is covered. 15,000, that is so little, mega. That is the amount some people will pay for the registration in the first place. So looking at those things that it covers, we talk about dentistry. In dentistry, you have dental check, scaling, and polishing. Some persons, your tooth, they are looking yellow and things. You can go and do polishing there, and then they clean your teeth for you, and the insurance something is covering it. Minor oral surgeries is covered. Root canal treatment, where you have to uproot one of your incisors or one of your tooth is covered, replacement denture, and all dental cases that cannot be handled by the primary level. So, physiotherapy care for the following condition: post-trauma rehabilitation, management of pulses within 15 days after initial treatment, maximum of 5 sessions. It's not going to be forever, you understand? Post-cerebral, oh my God, the English are big, man. You can read it, my friend. So now, the primary health care, we have the child welfare service, which include growth monitoring, routine immunization, nutrition advice, and health education. Then we have the family planning services, which include family planning education only. It does not include, oh, they are giving you, pregnancy preventive things and things. No, they are not there. Then we have ANC services also, investigation, PCV. You want to do your PCV test, you want to do urinalysis, blood group test. Some you are here, you are listening to me, you don't even know your blood group. You can just register this and go do. We have HIV screening, FBS, and so on, routine ANC drugs, immunization, maternity care, ANC delivery and postnatal care. All live births eligible to cover will be covered for 12 weeks from the date of birth. So now that is these are some of the benefits that you get. Then we have under the gynecologist area, you have including acute PID, vaginal discharges, routine maternity care for all pregnancies except where complications exist. Now for eye care it includes conjunctivitis, simple contusion, abrasions, foreign bodies, and so on. Dental care, we've said it, mental health, and so on. And so emergency care, surgical care. I think you can watch some other videos that we have done where that we have explained some of these things. So benefit package, total exclusions. That's what are the things that are excluded. Occupational or industrial injuries. Okay, somebody went to the office, a tractor hit him, he fell in the office. That kind of thing is not covered because the workplace is expected to get what we call workplace insurance. Injuries resulting from natural disasters and earthquakes, just like what is going on in maybe Florida now and things. If you have an injury in that area, it's not covered. Epidemics like Ebola, Lassa fever, COVID-19, WHO, World Health Organization, they take care of those kind of one. Then family planning commodities, including condoms. No, you are not. Those ones are not covered. Injuries arising from extreme sport. You eat belefu now. You say the next thing to do to go to climb mountain. You want to climb a mountain. You now fall down. Oh my God! Sorry for you. That is not going to be covered. Boxing, wrestling, car racing, horse racing. It's people that have eaten and belefu that do that. Or you get what I'm saying? Surgery. So what kind of surgery? Manotoplasty, that aesthetic surgery. You want to do facial change and everything like that. It is not covered. So under total exclusions, also we have all these that you can just pause and watch. Look at the areas that are not covered. So why referrals? Reasons for referring from one level to another. So some covered benefits are procedures that cannot be handled at the primary. So because of complexities, because of competence of personnel, because of capacity of the healthcare facilities, they can be scaled to another one. Do you understand? So all cases that cannot be handled at both the primary and secondary levels of care, except those conditions. You understand? So we get that. So I think I've explained this. Now, ladies and gentlemen, you want to ask then, how do we come into this? How do I become a beneficiary? How do I get plugged in? Just like we said, you can be a part of this thing from anywhere. But we in the cooperative, the Rich Vision Cooperative, we are working together with our members to give them these health services because there are some documentations that are necessary to be done. So we help them in the processing. We help them to do the processing and everything like that. We are not charging anything. These are some of the benefits that you get as a corporator. Do you understand? Now, what is the Rich Vision Cooperative all about? It's individuals coming together to enjoy some mutual benefits from themselves. So number one, it will help you, the Rich Vision Cooperative will help you to cultivate a saving culture and habit. You get a return every year at the anniversary of your stay in the cooperative every year. You get 10% on your savings once you are more than 12 months. You can also access interest-free loans up to twice what you have saved. Now, what we're talking here is this. What we're saying here is this. If you've saved money in the cooperative, you've saved 100,000, you can access up to 200,000 naira in the cooperative. Do you understand? You can get up to 200,000 in your cooperative. Now, that is twice what you have saved. And mind you, in the cooperative, we don't ask you for collaterals. No, because our membership spans across the world. We have members in the US, we have members in Australia, we have members in Kano, everywhere they can just connect. And also, as a thrift manager, you will be getting a monthly commission based on the number of activities of members in your team. The cooperative is like a two-in-one. You can be a cooperator and also a thrift manager. Now, you are looking for an alternative income source, this is where it comes to play for you. If you want an additional income source, all you need to do, be part of this cooperative and you refer your friends to the cooperative. 4%. Remember, the thrift managers, the Babala, Jaws, and so on. You remember, if you are aware of that business line, there's a percentage that they take every month from the contribution that the people have made. So also in this situation, once you have team members, people that are making contributions, you probably brought them in the cooperative, you are earning some amount of money. So as street managers, you can get loan in multiples more than just times two. Then we have the healthcare insurance scheme, just like I have just explained. Then we have the life insurance for yourself. That you begin to enjoy that when you get to some certain ranking in the cooperative. Then we have the car and housing benefits of up to 75 million. You are thinking of how to buy a car, how to build a retirement home. The cooperative has a plan for you. We call it the Rich Vision Home Plan Scheme. So, ladies and gentlemen, those are the things that you get to enjoy in the cooperative. All right. So ladies and gentlemen, when we all this put together, the important thing is you being strategic in your finances. Being strategic, you might not be able to make extra money, but you can manage and control the ones that you have. You don't wait for challenges. You don't wait for challenges to happen, and then you are running helter-skelter to meet up medical expenses. That would be as if you did not plan. They say he who fails to plan has planned to fail. What of your children? What of your family members? If you could just take it upon yourself. It could be a kind of community service. Look at these Okada riders and things in your community. And you want to, help them. Manual drivers, get about 10 to 15 of them. You want to do philanthropic work, register them in this scheme. 10 of them registered in this scheme, that's 15 times 10, that's 150. That could be good community service. That could be good community service. So if any of them have an issue, they can run. You go to your village, look at the community. How do you help? You don't just go there and say people are suffering. What are you doing? So you can decide, take a family, take a family that they are not doing well. Just register them in the scheme. Anytime they are sick, they go to the hospital. They will thank God for your life at all times. So, ladies and gentlemen, there are a lot of things that are around this health management. I want you to think about it. Is it good? Will it help you? Will it help the people around you? Don't you think it's something you should give a thought? Don't wait till that thing happens. Don't wait. That your security guy, your house help, your mates, get them registered under the scheme and we will help you. Now, in addition to that, what Rich Vision is doing is this. If you join, for all our members, if you're a member, you are more than 6 months in the cooperative. Oh, I don't have the 15,000 naira to do the registration. Don't worry. Tell us you want to do it. We are going to help you do the registration. We will register you. And that is what we are here for. Quite a number in the last batch of about 20 persons that we sent to the NHIA, quite a number of them did not pay. They did not pay. But what we did was, from the cooperative, we paid for them. And what they just need to do, every month, they pay 3,000. So by the time they pay 3,000 in a period of 5 months, have they not finished paying their money? And they enjoy their health. So that is what the cooperative is doing for its members. Now, for those ones that want to say, okay, no, I want to get everything paid once and for all, you have the opportunity to do that also, where you can pay once and for all. So, ladies and gentlemen, I would like you to get back to the person that invited you or that showed you this opportunity. Please, for your own sake and for the sake of people around you, let's manage our finance. Healthcare service, insurance is one of the ways you use to manage your finance. Don't let money that you worked hard for go into medical bills when it has been provided for. So, ladies and gentlemen, that would be for it. That would be all for it. I remember myself, Olushola Popola, chartered accountant, investment advisor, and also a life coach, and also the president of the Rich Vision Cooperative.